Hello everyone! As we all dive into the world of telehealth as a mode of delivery, I thought I would chat with you a little bit today about working with children. Because as you all know, telehealth has its own sort of set of nuances, right? But when you are working with children, that just changes the dynamic completely. You've got to worry about a lot more than just technology. You've got, children running off or not paying attention, engagement, all those sort of issues that come up when you're working with children. So I have 5 strategies for you today. The first one is pair yourself with reinforcement. So if I know Johnny likes M&Ms, right? I've already discovered that by chatting with mum. I would say to mum, could you save M&Ms for when he has sessions with me? Because what happens then is that he pairs me with something good and he's more likely to be engaged and he's more likely to comply in session. So that is the first tip. The second tip is lower your expectations. When you are seeing a student in a one-on-one setting, in a clinic perhaps, you have the ability to act really fast and you can change the environment really easily. Well, when it's on telehealth, you may not be able to do that because there's so many confounding variables, right? The mum might be the facilitators, they might be siblings, the setting might be different. So it's really about lowering your expectations. And the other facet of that is by lowering it, you're reducing stress for yourself and also you're achieving success for everyone involved. The child feels success, the mum feels success, and therefore they're more likely to participate in telehealth sessions. So if my goal is Johnny will stack 5 blocks, maybe I change it to Johnny will only stack 2 or 3 and be happy with that goal and then grade up from there. The third tip I have for you is using a 1-to-3 ratio initially. So what I mean by that is maybe you would do one activity that might be challenging for Johnny, but then you want to follow it with 3 small tasks, activities that are very reinforcing. So let's just say I'm doing handwriting with Johnny and that's a challenging task for him. Then I might say, okay, you get to do 3 things that you really like. Maybe it's Play-Doh, a YouTube video, and bubbles, for example. So it's that 1-to-3 ratio. And then slowly I taper that off and change it to make it a little bit harder. The fourth tip I have for you is creating boundaries. This is so important with telehealth because often the laptop, the computer might be sort of in a communal area where there's mum and dad, relatives, friends, siblings coming in and out, lots of distractions. So you want to try to sort of hone in the environment and contain it a little bit, offering to work with the student in their room or playroom. Also table and chair setting, creating those boundaries really helps with improving attention. The 5th and last tip, which is probably the most important, is when you're working with a student and say they are misbehaving or just whining, whatever, you want to act like a light switch. What I mean by that is completely take out all emotion and engagement and sometimes even eye contact. Sometimes I might just turn my video off because I can see that Johnny is really not paying attention and engaging in behavior that is not acceptable. And then when he starts doing what you asked him to and behaving in an acceptable manner, then it's like have a party, be a light switch, turn that light on, really provide that reinforcement and engagement because that will really change and shape the student's behavior to be more amicable during your sessions. So those are some tips for you. If you'd like more tips like that or more in-depth knowledge on this topic, please check out my 2-hour course. It's called Strategies to Overcome Common Challenges in Pediatric Health, and it's sponsored by Telehealthshare. It's going to be live and also on demand. And those demand sessions will be available very soon. This course is approved by AOTA for 0.2 CEUs, and we will, of course, provide a certificate of completion. Hope to see you soon. Thank you. Bye-bye.